My name is Julie Batatas. I am the blood bank coordinator and specialty supervisor at Evolution Veterinary Specialists. Most people don't know that blood banking is a thing that happens with animal medicine. Surprise, everything that happens in human medicine can happen in animal medicine. We use blood quite frequently, and there's a lot of different products that we can get from blood donations that can be life-saving for pets. We do blood banking for both dogs and cats, and then we also do emergency donations for ferrets as well. Our dogs, we have two different main blood types, positive and negative. Negative is our universal type, but positive dogs are just as important as the negative dogs. For cats, they have type A and type B and type AB blood. We do have a colony of cats live at the hospital. There's 3 cats that currently live here. For cats and dogs, our requirements to be in the blood donor programs. For dogs, they need to be anywhere from 1 to 8 years old. They need to be 50 pounds or more, just so we can take an appropriate amount of blood. They need to be well-mannered, well-behaved. They need to not have had a blood transfusion before. We have quite a few people that learn about blood transfusions after their pet receives one. Unfortunately, they can't give blood anymore. For our cats, they need to be between 1 and 9 years old. They need to be around 8 pounds or more. They need to be indoor only. If they're outdoor cats, they can get some bloodborne pathogens that you don't really recognize that can be a problem to pass on to other patients that are immunocompromised. For all the pets that we have in our program, they need to be off certain medications. So please bring up any medication your pet might be on, because it's not necessarily going to exclude them from the program. It's just going to make it so it's safe for both them and the patients that are receiving their blood. I've seen a lot of patients that could have received life-saving blood as a treatment that have actually had to be euthanized or passed because there's not products to be able to give them everywhere. My goal with running a blood bank is not only to be able to supply blood for our hospital, but also to supply blood to any of the surrounding hospitals in the Denver area. I've noticed that a lot of places tend to have small blood banks and they tend not to sell to other hospitals, but truly I want to make this the kind of blood bank where we don't say no to people. So if someone calls and needs blood product, I can say, yes, we have that blood for your pet. Please come and get it, because I want to be able to save as many lives as possible with the donor program. Beyond the benefit of just having the knowledge, knowing that your pet is a hero, we also do $25 credit per donation that you can use at services for the hospital. We do a reduced cost on preventatives like flea and tick preventatives and heartworm preventatives. We do a free echocardiogram if your pet ever was to develop a murmur, just to make sure that they're still in a healthy condition and that they're still safe to donate and that they're still safe in general. And every appointment that they have is they get a full doctor's exam and a small blood panel ran. They also get full blood panel every year. It's about a $600 value. It includes blood, urine, and stool. That's all checked out for free by our hospital. I've also caught a lot of stuff really early on in a patient where it would have been detrimental to them later on because they're coming into the vet regularly about every 2 months. I've caught a dog that needed a pacemaker. I've caught a cat that had stomatitis all in its mouth. I've caught an animal that had to have bladder stones removed. And this is just a benefit of being able to see the veterinarian on a regular basis about every 2 months. We use blood products in our hospital like several times a week, if not daily. The benefit of having your pet be a blood donor is you get to know that you're saving a life. For dogs, for 1 donation, it's up to 3 lives. For cats, for 1 donation, it's up to 2 lives. We ask that you stay in the program for a couple of years if you can. We're only asking that you donate every other month. As far as for the appointment itself, it can be a drop-off appointment and you can drop off and pick up. If you want to be present for the donation, you can. The appointment in total takes about a half hour to 45 minutes. It includes a doctor's exam, a small blood panel, and then the donation itself. And then they also receive fluids under their skin afterwards to help with hydration. It's been proven in cats that it helps them bounce back quicker. With dogs it hasn't, but it doesn't hurt, so we only want to help. They can go back to their normal activities afterwards. So same with you see a person go donate blood and then they go for a hike, you have to just read your pet. So if your pet gives a donation and they want to go running and play, they can go running and play. If they just want to chill the rest of the day, they can just chill and sleep the rest of the day. So many people see hospitals and they're like, oh, here's another way hospitals try to make money. This program isn't about making money. It's really about giving back to the patients. We break even. So with the blood bank, we pretty much break even with our costs. But with that in mind, it's to save a life, so it's worth it.